Namaste dear doctors, happy Vijayadashmi to all. Myself Dr. Yoganarasimhaiah. Today I want to share my experiences regarding Gomutrahareetaki formulation. I selected this formulation because it's a very simple formulation having different references in Brihatrayis like Charak Samhita, Sushruta Samhita and Ashtangahridaya. It has been mentioned. So the different diseases, first of all like Shota Chikitsa, Mukharoga Chikitsa, Udara Chikitsa, Pandu Chikitsa, Arsha Chikitsa and Shvitra Kushta Chikitsa, Anartava Chikitsa, Sthaulya Chikitsa. So like this the list goes on. So all these references we get for the use of Gomutrahareetaki, which is a very simple combination. In Brihatrayis and in other textbooks, it is mentioned like the preparation methods of Gomutrahareetaki. Like Haritaki is soaked in Gomutra under the sunlight and that is also called as Gomutrahareetaki. Haritaki grinded are given bhavana with in a khalva yantra, that can also be considered as Gomutrahareetaki. Haritaki is boiled in Gomutra, that is also a method mentioned, and Haritaki given with raw Gomutra, fresh Gomutra, that also indicated, and Gomutrahareetaki is given in leha form also. So like this different methods are of Haritaki, Gomutrahareetaki has been mentioned, but totally the combination is only Haritaki with Gomutra. So coming to the dosage, see dosage like though it is mentioned in the classics like 2 to 6 grams, I have seen in my practice the patients complaint of lots of tiredness and lots of gastric irritation with the dosage. That's why I prepare 3 types of different formularies, like one is churna form, another is tablet form and capsule form. I prefer 500 mg to 1 gram would be sufficient quantity of Gomutrahareetaki for a patient for recent days. Gomutrahareetaki Aushadha Sevana Kala can be, since it is a Kshara, you can give it in Kapha Kala, that is early in the morning, you can give in empty stomach, or before the food, you can select. And Gomutrahareetaki Anupanas depend on different diseases that I am going to explain. According to the diseases you can select, otherwise you can select with barley water or simple water can be Anupanas. Coming to the diseases where we can use Gomutrahareetaki, first of all in Charak Samhita it is mentioned Shota Chikitsa, Gomutrahareetaki clear cut indication is there. Acharya Sharaka says whenever the kapha is generated or kapha utpatti happens in Amashaya, that is distributed, Malarupi kapha is distributed to the in and around organs of Amashaya like Pufusa, like Hridaya, might be our thyroid gland, might be the Jatrurga Ashaya Avayavas like Mukha, Shuna, Akshikuta, Ganda. So all these indicates the kapha sramsana to the different parts of the body. So in such conditions we can go for Gomutrahareetaki. So here we can select Gomutrahareetaki Anupanas as per the disease. For example, if Amashayopta directly Amashaya Gata Vata or Amashaya Gata Kapha, you can directly select Gomutrahareetaki with water. If the doshas has entered the Hridaya, that is presented with Kaphaja Rudrogas like atherosclerosis and left ventricular hypertrophy or such disorders, you can select that too with the Stula Prameha or such persons. You can select Gomutrahareetaki with Arjuna Kashaya, Arjuna Kshirapaka. In respiratory disorders like when the kapha from the Amashaya is lodged in the respiratory, you may suffer from Bahurupi kapha like bronchiectasis, like pleurisy, or where the collection of water in the lungs, such disorders, you can select Gomutrahareetaki tablet 500 mg with Bharangyadi Kashaya. And in case of thyroid disorders, See, many doctors in practice, they also consider the thyroid as a shotha. So in such conditions where rasa dhatugata vikaras with medo vikriti is there, in such conditions you can select punarnavashtaka kashaya as anupana for Gomutrahareetaki tablet. And we also come across the Shuna Akshikuta Ganda, like Galaganda, or where the swelling in the throat region and swelling in the face, puffiness in the face, and sinusitis like disorders. In such conditions, they also indicate about the kapha utpatti from amashaya is distributed to jatrudga. In such conditions also, you can select Gomutrahareetaki with like Dashamula Katutrayi in sinusitis would be a better option, dear doctors. So this is how we can present this Shota Chikitsa we can use. Also Shota, if it is related with the renal disorders, you can select as per the renal problem Mutrakvitra and other drugs like Varunadi Kashaya and Trinapanchamula Kashaya along with Gomutrahareetaki, that can also be given in Shota Chikitsa. So this is how a different approach can be done as per your yukti in Shota Chikitsa. Then coming to Mukha Roga Chikitsa. Mukha Roga is very particularly indicated in indicated with the Gomutrahareetaki. So Gomutrahareetaki can be kept in the mouth as Mukha Dharana one, or it can be used like a Kabala with Triphala Kashaya. You can mix this Gomutrahareetaki powder or tablet with Triphala Kashaya. You can make the gargle of it and Kabala Gandusha with this. So Mukha Rogas, which and all Mukha Rogas we can do? It is indicated like Aphthous ulcers, you can go for Gomutrahareetaki. Internal Sevana also can be done, internal usage, and also Kabala Gandusha can also be done. And even you can use in oral cancers, oral carcinomas, Gomutrahareetaki would be a better option. And Shotha, like Mukha Roga, even tonsillitis, you can use this, pharyngitis, laryngitis, and where kapha involvement is more, better use Gomutrahareetaki in kapha involvement of, more involvement of the Mukha Roga Chikitsa. Coming to Panda Chikitsa, in Charaka Samhita it is clearly mentioned Pandu is a, though it is a Yakrut Pliha Vikara, Raktadhatu Vikara, when there is Amashayutta Kapha, it is brought down, it makes the avarana of the Kapha over the Yakrut Pliha, which are Pitta organs. So, Pitta Avrata Kapha presentations we see in Pandu. So, that's why many people present with Staulya, sometimes present with puffiness of the face, etc., with the Pandu, that is anemia disorders. So in such conditions you can select Triphala Kashaya with Gomutrahareetaki, 500 mg tablet morning and evening you can prescribe in Pandu. Then coming to the Udara Chikitsa. Udara is a Kleda Vyadi, Kledagata Vyadi. So there are different types of Udaras, Yakrudali Udara, Pliha Udara, so many Udaras are there, Jalodara is also there. In all such conditions, we can use Gomutrahareetaki. So in Yakrut Udara, you can select with Patala Katarahini Kashaya. In Pliha Udara, you can select Gomutrahareetaki with Pipali Kashaya. In Jalodara, you can select with this Gomutrahareetaki with Kshira. You can select. So like this in Udara, it will make the Shoshana of the clay, the excess production of the water in the body. So because Gomutra and Haritaki are Ruksha in nature. Coming to the Archa Chikitsa, it is mentioned in Archa Chikitsa like wherever the Gada Varchas presented with the Agnimandya, in such conditions, whereas there is a constipation associated with Agnimandya, in such conditions Gomutrahareetaki would be better option as per Dallana commentary also in Susha Samhita. So how this acts, see the constipation can be a Pitta Kshayajanya Vyadi. We always see Rukshata in Malabaddhata. You also see Pitta Kshaya in Malabaddhata, where Pitta Kshaya happen because of lack of secretion from the bile from the liver. So Pitta Kshaya happens in the stools. That's why Saraguna will be less. By supplementing this Gomutrahareetaki, Gomutra itself is a type of Pitta. So this makes Agni Deepana and it also mixes with the stools. So Mala Agni Deepana, Jatar Agni Deepana, and Pitta mingled with the Mala will make Malapachana. So that will be eliminated very easily with this Gomutrahareetaki tablet. But precautionarily they have told use Gomutrahareetaki with Guda, because they have mentioned the previous the prescription especially Gomutrahareetaki is soak the Haritaki in Gomutra with Guda. This is how it is used, but this we are using the tablet form, so you can add Guda Jala with Gomutra. That will also have molasses effect, which will help in cleansing the stools, Malapachana. By that, since Gomutra is a Kshara, so Kshara can also be used in Arshas, because it is a type of Chikitsa in Arshas. That's why Gomutrahareetaki helps. But you should be very careful regarding the complication of Gomutrahareetaki producing Rukshata if it is used in more quantity and long duration. That precaution has to be taken. Then coming to the Anartava Chikitsa, Acharya Sushruta, he mentions in Anartava presentation, he mentions different materials to be taken, like Haritaki, Gomutra, Matsya, such type of even food materials are also mentioned by the Sushruta, Acharya Sushruta. So Gomutra and Haritaki can be a better combination in Anartava. So what is Anartava? Anartava is presented with PCOD, polycystic ovarian diseases. So there are two types of presentations. One is bleeding presentation, one is postponed cycles presentation. So in Anartava, where there is missed cycles, only in such conditions go for PCOD conditions, go for Gomutrahareetaki. You can select Sukumara Kashaya with Gomutrahareetaki. And even sometimes thyroid changes in the T3, T4, TSH, there is cycles disturbance or irregularity of the cycles, that is also considered as Anartava. In such conditions also use this Gomutrahareetaki with Sukumara Kashaya or Saptasara Kashaya, like that. Even tumorous presentations conditions, you can go for Saptasara Kashaya with Gomutrahareetaki. Then coming to the Shvitra Kushta Chikitsa, it is mentioned in Samhitas, like wherever there is a Kleda presentation in the Kushta, like eczemas, pyoderma, Pama Kushta, such type of oozing disorders. Of course, Pama, according to Charaka, is not oozing. According to some people, that can be a oozing disorder. In such conditions, oozing disorders, you can select this Gomutrahareetaki tablet. Go with the Kadira Sara Jala or Kadira Tvak Kashaya, sufficient. This can also be used Shvitra, in Shvitra. So Kadira Tvak Kashaya, Kadira Sara Jala with Gomutrahareetaki would be better prescription in Shvitra Chikitsa also. Then coming to the Sthaulya Chikitsa. In Sthaulya, very clear indication is there. So you can use this Gomutrahareetaki with Triphala Kashaya or Varadi Kashaya. So you can use this Gomutrahareetaki early in the morning, and also Gomutrahareetaki is having a property of Daurgandhya Hara, so which is a Sthaulya complication. Complications of Sthulas are like Gurutva of the body, Daurgandhyata of the body, Atisvedana of the body, Spik Udara Lambana, all these are the complications of Sthula. So in such conditions you can use Gomutrahareetaki. Asanadi Kashaya also can be best Anupana if Sthula Prameha Chikitsa if you want to select. So like this, these are the different presentations, different usage of Gomutrahareetaki. As per the yuktis, you can select this Gomutrahareetaki, still more usage can be done. Miscellaneously, I also use this Gomutrahareetaki in triglycerides. I had used Gomutrahareetaki within a month. Even 350-400 units of the triglycerides has come down to the normal 150 by a month. So you can get very good results for triglycerides with Gomutrahareetaki. And like tumorous presentations, carcinoma presentations, of course, the treat is questionable, the result is questionable. So with the cystic presentations, tumorous presentations, varicose veins, varicose seal, in such conditions we can go for sinusitis, Kapaja type of Pina Satakashayas, kasa. In such conditions, we can go for this Gomutrahareetaki formulation. So, dear doctors, you can prepare this Gomutrahareetaki yourself, or if you want, you can contact me for my mobile number 9964313536 and get the benefits of Gomutrahareetaki. Single drug, multiple utility, single investment, many benefits. You can take the use of these informations, and also for the raw materials required for Ayurveda preparations, you can contact 9964313536. Thank you very much, doctors.